Hello, friends, and welcome to the Union Labor Advisory Network podcast. I'm your host, Mike Fina. In today's episode, this one you won't want to miss. I'm honored to be joined by Mary Fogarty, the National Taft-Hartley Liaison at Solidaritus Health. Mary brings decades of experience in behavioral health, labor advocacy, and union-centered healthcare innovation. Today, we dive deep into what Solidaritus Health is doing to transform healthcare for working families. If you've explored direct or advanced primary care, on-site clinics, or cost containment strategies for your health and welfare fund, this episode will open your eyes to a new model that's built by labor, owned by labor, and exists solely to serve labor. Mary walks us through how Solidaritus is not just delivering concierge-level VIP care, but also generating 5 to 27% cost savings for union funds through advanced member-first healthcare centers. We also talk about how local unions can invest in the benefit of this model while keeping decision-making power firmly in the hands of labor leaders. This is an important conversation about building sustainable, high-quality healthcare infrastructure for our members and their families. Let's get into it. Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm extremely proud and privileged to be with Mary Fogarty, National Labor Liaison for Solidaritus Health, to learn a little bit more about her background, history, and experience, what Solidaritus Health is doing in today's labor market. I'm really excited to be with you. I've known Mary for quite some time, for pretty much most of my labor career. So really excited to sit down and for her to share a little bit more about your background, history, and experience in the labor space.
Thank you so much. It's such a privilege to be here with you. I love this. So just a little bit about my background. I come from a labor family, a whole family of iron workers, you know, police, fire, all those Irish jobs that nobody else wanted way back when. So very, very privileged to be a part of a labor family. My history with labor, as far as work goes, is I've been very heavily into the behavioral health side of helping members. I did some marketing for treatment way back and then became members' assistants for several of the ironworker locals doing apprentice trainings, drug testing, education and wellness training for the apprentices as they came in. Also being able to contract directly with treatment centers to save the self-funded unions money, which of course is so key now.
Absolutely.
Yeah.
Absolutely.
Yeah.
And the members assistant programs, obviously, in the Taft-Hartley and the building trades is so needed. And, you know, it's again this white glove service and supporting those particular members for their health and quality of life. It's, you know, you're doing God's work, so it's really, you know, great.
Yeah.
So tell us now about the transition and shift, because it's been really exciting. Again, so you present at the Building and Construction Trades, in March, and now we're here at the Long Island Federation's annual event. So really excited to be here.
Thank you. Thank you.
So tell us about this transition
So
now.
I'll tell you about this. So a friend of mine who I met in the behavioral health space for years, we both were very passionate about that, approached me back in January with the idea of working with a company that is owned by labor, built by labor, and labor profits from it as well as saves. So there's a double bottom line.
It's triple threat.
Triple, yes, absolutely. So it's really a labor-owned company anchored in primary care. So advanced primary care for self-funded unions to help them save their overall healthcare spend.
Okay.
So there are 17 Taft-Hartley funds that have invested in this company, and it's owned by labor, the decisions are made by labor, and it's strictly for labor, for their families and their overall wellness.
And are these medical facilities? Or
They are advanced primary care. So what that means is VIP care, a family doctor that has no more than 1,200 patients on his caseload, which means that you no longer have a 7-minute appointment with a doctor you don't know. You don't have to walk into an urgent care to a doctor you don't know. You don't have to go to an emergency room where most of the visits could actually have been handled in a primary care setting. You have same day or next day appointments with a doctor, again, who knows you. So these are family practitioners. Solidaritus works for the fund. The doctors and the nurses work for Solidaritus.
It's incredible.
Yeah.
And now, from an insurance standpoint, how does that work? Does it work with the general carriers to be able to support those particular programs, or how does that work?
Yes. So there is absolutely no plan design change with Solidaritus Advanced Primary Care. What happens is it's a per member per month fee, and there are no claims to the fund aside from that per member per month fee. So people come in, they have, like I said, same day or next day appointments. The minimum appointment time is 30 minutes to 45 minutes, right? Because you're actually having care done by a doctor who knows you and your family. And there is an overall net savings after the per member per month of anywhere between 5 and 27% savings on the whole entire healthcare fund save.
It's incredible.
It's incredible. It's really going to change the way healthcare is delivered to the self-funded union.
And so you're building out these particular facilities with labor?
With labor. So there will be a PLA on every site, and we can either build ground up or do a refitting of an already existing space. We need about 2,500 square feet. We are actually presently building an advisory board for Nassau Suffolk Building Trades. We have our first meeting tomorrow. We have about 35 business managers that are going to pick the initial sites.
That's
I know, it's amazing, right?
Now, again, you've done this before, so I'm sure there's other states that have taken advantage of some of these particular programs. So almost it's like building out like a franchise facility.
Yes.
So like you said, 2,500 square feet. This is what it needs to be put into these particular facilities.
Yeah.
And then you also mentioned about the investment. So is this an investment into some of these people, to the Taft-Hartley funds? So they're going to return. There's a return on that investment.
There's a return on that investment. So there are several ways that they can have a return on their investment. Number one is, of course, their overall health and welfare fund save, right? That's the initial, if they participate in a center. Second, they can invest a pension fund into our equity company, which is, again, only labor. And or they can invest directly into Solidaritus itself and have a seat on the board. Wow. So there are many ways that they can, work and be a part of. And again, all the decisions are made by labor leaders.
That's great.
Yeah. Long Island is, as you know, very geographically challenged, right? So the centers that you mentioned that we have in California and Oklahoma and Wisconsin, the people who are participating in the centers kind of live right there. So what we're doing here is we're building coalitions so that as a local has members that live maybe North Jersey, the city, the boroughs, Westchester, Long Island, we can have different centers that everyone who belongs to the coalition, their members can use whatever center is
like a gym membership, right?
Yes, it's like a gym membership.
So you have the members, you can say, you know what, I'm close to this facility, I can access this one versus this one because it's closer to my home.
Yes. And the local doesn't have to put all the membership in immediately. Like the first ones that we're building, they can have, let's say they have 5,000 members, but they have 1,000 members that live closest to this center. That's how they can start. They don't have to commit the entire membership immediately as we're doing the build-outs.
Gotcha.
Yeah.
Yeah, so it's because there is an engagement or a transition period, and people need to get comfortable with these new facilities, make them aware that the facilities are actually there.
Yeah.
And then their primary care doctor, or if they don't lack of one, then you can actually find somebody that you're going to have an intimate relationship with from a doctor's standpoint.
Yeah, exactly. Exactly.
Wow.
And that will be up to Solidaritus, too. We have an entire marketing team. We have an expert marketing team. And so we'll engage with Union Labor Advisory Network, and we'll engage with, social media as far as, Instagram and Facebook and all of those things. We'll do email blasts. We'll educate the membership that these are your dollars. These are the dollars that you work for that are not going into your pocket because it's this big, huge healthcare spend. So we're working on changing that for the membership.
That's really exciting.
Yeah.
It's really exciting. And then now you haven't, you've done it. I guess it's proven success on the West Coast.
Yeah.
Now you're bringing it to the East Coast.
Bringing it to the East Coast.
And you got Mary Fogarty running.
Mary Fogarty
in town running this stuff out.
Yeah.
So you know it's going to be successful. I mean, it is.
Thank you. And you know what? I'm very, very, very grateful for the relationships. I'm very grateful for the people in labor who truly I know these leaders and their sole goal is to care for their membership. So I'm very blessed to be a part of that.
Yeah, and I'm very blessed to know a lot of different people as well. I mean, and just, their passion to really help and support union membership.
Yeah.
I mean, again, I go back to like my Rotary Club and the motto is like service above self. And you look at the executive leadership and they're trying to serve their members the best possible way.
Yeah.
Negotiate those best, possible services to support them and their families.
Yeah.
As well as career opportunities too. So, okay, I'm excited for you, Mary. Thank you for sitting down with us to learn a little bit more about Solidaritus and what you guys are doing.
Yeah.
And I'm excited to see the progress over the next couple months and work with you to promote and support labor the best possible way.
Thank you. It's a real legacy that this part of labor can make for their membership and for their families. When I was growing up, of course, right, my father was in the city. He was an iron worker. So, of course, the skyline has greatly changed, as we know. But my grandparents were still in the city, and I was bringing my daughter, who's now a grown woman with her own children, but into the city with me to get my grandparents. So we're going over the Triborough Bridge, and she looks out, and it was a beautiful night. It was dusk, beautiful skyline. And she looked and she said, "Is that the kingdom Poppy built?"
Oh.
Right? So this is, that was their legacy, right? They built that city. They continue to build that city, and the skyline is ever changing. And this now can be the new legacy. They can change how healthcare is delivered to them.
Absolutely.
By them.
By them.
For them.
Exactly.
In every way. Yeah.
So it's really exciting.
Thank you.
Look forward to working and showcasing a lot of the information that's going to be out there as well. So again, Mary, thank you so much for sitting down with us and appreciate all your time and support of labor.
You guys are great. Thank you so much.
You got it, man.
Good to see you.
All right.
Take care.
I'd like to thank all our sponsors for helping to build and promote the ULA network. It is because of you that we're able to support, educate, and promote informative content relevant to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.